Have you ever stopped to think about what we've lost in our modern indoor lives? I mean, really lost. What if I told you there's one thing, something so basic and fundamental that could be a huge key to our health, and we've almost completely cut it out? Well, this is a story about how rediscovering it can, quite literally, change everything. I just want to go outside. Now, these weren't the words of a kid who was grounded. This came from a 15-year-old boy. It wasn't a request for a new phone or his favorite food. It was the dying wish from someone who doctors said had only a couple of days left to live. So here's the backstory. This boy had a really aggressive form of leukemia. And while he was going through chemo, he gets admitted to the hospital with what everyone thought was just some respiratory infection. But it turned out to be something way, way worse, a fungal infection in his lungs that was completely out of control. And the scary part is just how fast everything went south. Within a single month, the fungus was so bad they had to remove his entire left lung. But the infection didn't stop. It just jumped over to his remaining right lung. And even with the strongest antifungal drugs out there, he just kept getting sicker. And that's when it happened. The doctors had to call his family in for that awful, awful meeting. They tried everything. Every medical option was exhausted, and they had to look this 15-year-old in the eye and tell him he was dying. When he asked how long he had left, they told him, probably 2 days. So the medical team, they asked him, is there anything at all we can do for you? Anything you want? And his answer was so simple. I just want to go outside. So they did it. They gathered up his ventilator, all the IV poles, the whole setup, and they wheeled his bed out into the sun for what they all thought would be his final moments on Earth. But this is where the story takes a turn that, nobody could have seen coming. He didn't die. In fact, within just hours of being outside, he started to get better. And we're not talking about a slow, gradual improvement. We're talking shockingly fast. Just look at this. These numbers are incredible. After just 5 days of spending time outside in the sun, his white blood cell count, which was a huge marker for infection, it went from a sky-high 20,000 all the way back down to normal. His fever, gone. He was breathing on his own, completely off the ventilator. And then they did another CT scan of his only lung, and you could hear a gasp in the room. A lung that had been 80% filled with fungus was now almost totally clear. So you have to ask, how is this even possible? This is a recovery that, modern medicine just couldn't explain. He was on all the same drugs. Literally the only thing that changed was going outside. So what on earth was actually going on here? Well, the answer is deep, deep inside our cells. It has to do with these trillions of tiny powerhouses that are basically running the whole show. We need to talk about your mitochondria. The easiest way to think about mitochondria is to picture them as the engines in your car. They take the fuel, the food we eat, and they convert it into energy, a molecule called ATP. And that ATP powers literally everything, your brain, your muscles, your immune system, everything. But just like a car engine, they can sometimes run pretty rough. And this slide really nails the difference. On one side, you've got this sputtering, struggling engine, and on the other, a supercharged one. It turns out that a specific part of sunlight, infrared light, that's the part you feel as warmth on your skin, it's like a turbocharger. It helps that energy production line run way faster and smoother, and it also triggers the mitochondria to make their own melatonin, which is like a built-in coolant that prevents damage. Okay, so you might be thinking, that's an amazing story, but it's just one story, right? A one-off miracle? Well, actually, no, not even close. Hard, rigorous scientific studies are finding the exact same thing. Let's dig into the data. Check this out. This is from a big, triple-blinded, randomized controlled trial down in Brazil. Patients in the ICU who got just 15 minutes of infrared light every day had their stay in intensive care cut by a staggering 30%. And not only that, they actually left the hospital stronger than the group that didn't get the light. And then there's this study. It's a real shocker. A massive Swedish study followed 30,000 women for years, and what they found is just mind-blowing. The risk of dying for women who actively avoided the sun was pretty much the same as for women who loved the sun but were smokers. Let that sink in for a second. Avoiding the sun was literally as dangerous for your long-term health as smoking cigarettes. And this pattern just kept popping up, especially during the COVID-19 pandemic. Study after study in different countries found that areas with more sunlight had better outcomes. And it wasn't just about vitamin D. There was even a study showing that using infrared light therapy on hospitalized COVID patients cut their stay from 12 days down to 8. That's 4 whole days. So if sunlight is this incredibly powerful, why is this even an issue? Well, it's because we've basically spent the last century systematically engineering it out of our daily lives. Get ready for this number because it's wild. An EPA study found that we spend, on average, 93% of our time indoors. 93%! And here's the kicker. That study was from 1990. That's before smartphones, before Netflix, before remote work really took off. I think you can guess that number is probably even higher today. A really powerful way to think about this is it's like a modern form of scurvy. You know, hundreds of years ago, sailors were getting sick and dying on long voyages because they didn't have any vitamin C. Well, today, we're suffering from a massive, chronic deficiency of something just as vital: sunlight. And listen, don't think sitting by a window is going to cut it. It won't. Modern windows and almost all of our indoor lights, like LEDs, they filter out those crucial infrared wavelengths we need. There's no substitute here. The only way to really get this fuel for your mitochondria is to actually go outside.
So what do we do about all this? Is there an answer? Well, yeah. And the best part is, the solution is incredibly simple, it's totally free, and pretty much every single one of us can do it. Here's your simple 3-step plan. Number 1, just flip the switch. Get 15, maybe 20 minutes of sun. That's all it takes to turn on and supercharge your mitochondria. It's about consistency, not about baking for hours. Second, set your clock. Get bright sunlight in your eyes soon after you wake up. That syncs your body's internal master clock. And third, try to eat with the sun. Align your meals with daylight hours. It all works together to support that natural rhythm. You see, that story we started with about the boy, it wasn't some kind of magic. It was just biology. It was a powerful reminder that our bodies are these ancient machines that evolved to run on a fuel we've almost completely forgotten to give them. And it really leaves you with a big question, doesn't it? What other simple, powerful truths about our own health have we left behind in this modern world?